It is my incredible pleasure to introduce our keynote speaker, Linda Smith. Linda Smith is the Director of Policy at the Buffett Early Childhood Institute at the University of Nebraska, with a specific focus on military, rural, and tribal care, early childhood financing, and engaging the business of community in child care initiatives nationwide. Before joining the Buffett Institute this spring, she served as director of the Bipartisan Policy Center Early Childhood Development Initiative. Prior to that role, she was Deputy Assistant Secretary for Early Childhood Development in the Administration for Children and Families at the U.S. Department of Health and Human Services, and the Executive Director of the National Association of Child Care Resources and Referral Agencies, where she represented more than 650 community-based agencies. She also served as the Director of the Office of Family Policy for the Secretary of Defense, where she was one of the primary architects of the Military Child Care Program. Linda began her career in early childhood education on the Northern Cheyenne Indian Reservation in her hometown of Montana. Please help me welcome Linda Smith.
Well, thank you, and good morning to everyone. It gives me a great deal of honor and pleasure to be back with you again. The last time I spoke to this group was I was thinking about it, getting ready for this, was in 2020, and it was the beginning of COVID. And it was interesting because it was the first Zoom thing we were all trying to do. And I still to this day am surprised that you asked me back, because I was never one that was, I don't think, very good on Zoom. But in any event, I went back to look at what I had, what I had talked to you about then. And it gave me a lot of pause in terms of where we've come in a short period of time in this country. Because my whole presentation was about the broken business model of childcare. And I would honestly say that who would predict that 4 years later, this country gets it? And it's because of COVID, in part, that we now understand exactly why the business model doesn't work, and what we really need to think about and what we need to do to fix it. Before I get into the details of some of this, I want to say to you, bring you a message from Washington, in that I think people need to understand, and thank you, Senator, for your remarks, because still in Washington, child care is a bipartisan issue. There are plenty of people on both sides of the aisle that want to fix this, that understand the issue. And I think that's very important this day and age, where we have so many things going on and some of them not quite so nice. In the next few years, and the reason I think I want to talk about the urgency now to not lose sight of what we need to do, is because all of the major legislation for early childhood is up for reauthorization. The Child Care and Development Block Grant, Head Start, ESSA that has the education Part B and Part C dollars in it. All of these things are coming up for reauthorization, and we have an enormous opportunity to fix all of these things and align these programs better. Now, you in Nebraska can say, well, I'm not too sure I care about that. Well, everybody needs to care about it, because the two, the state and the federal, are inextricably linked, people. The money coming into the state, you need to weigh in on that, and the rules that come with that money. Because you heard some of the conversation already about the rules of, that come along with some of what we're proposing to do. So people here need to weigh in, need to understand it's bipartisan, and need to understand that we have an enormous opportunity in front of us in the next few years. And I'm not kidding on that one. So Okay, so back to the issue of what have we learned since 2022. And I would say, or 2020, I'm sorry. I would say we've learned several things. And if anybody disagrees, you can, I know they didn't do a frowny face little thing, but you can wave something and say you disagree with me. We've learned that childcare is essential. It was essential during COVID, and it's even more essential today because of the needs of our economic development, our businesses, and our communities. Does anybody not agree that we have a broken business model? When even the Secretary of the Treasury calls it a textbook example of a failed market. So we have much bigger issues to deal with. What else did we learn during COVID? Well, we learned that ARPA worked. It put a lot of money into the states, and it shored up that failing business model. And I want you to think about why it worked. Because yes, it worked, and money is always good, but money without, dealing with the basic issue is not good. And so it worked because it put money into the supply of childcare and stabilized childcare across this country. And that, if we had not done that, we would have had a complete collapse of childcare during those two first years. So ARPA worked, stabilization money worked, and it worked because it addressed two things, the supply and the demand for childcare. Both sides were addressed in that, the stabilization money being key. So what didn't we learn? Well, I think there are plenty of lessons, and I'm gonna be, I think, doing some really blunt talking right now, and I want people to think about some of these things. We didn't learn how to move an issue, and I'm gonna tell you why I think that. We reverted to a go-it-alone strategy. Right is on our side, and it's all or nothing. And I say that when I talk about what happened with Build Back Better. Why did Build Back Better fail? Now, we've heard all kinds of reasons why it failed, and I'm going to give, these are my assessments from having worked in Washington while all this was going on. It failed, number one, because we lacked answers to the key questions that Build Back Better was trying to address. And what are those key questions? Well, what do you need and how much does it cost? And we really couldn't answer those critical, very basic questions when members of Congress asked them. And they had every right to ask those questions, okay? So we didn't, and now this is the critical piece for this group. We didn't have support in the right places. And I say to people, when you are trying to pass legislation that is literally $400 billion in cost to America's taxpayers, but you don't have the business community with you, you don't have the faith community with you, you don't have parents with you, you don't have health care with you. None of those people were involved in the conversations about passing Build Back Better. So we think in early childhood sometimes, and this is the pill you don't want to swallow, is that we can do this by ourselves. We can't, people. We cannot do this alone. And that's why my message to all of you is to basically open up the tent here. And I see it here in Nebraska, and that's an absolutely terrific thing to see all of you out here from all parts of the state and all parts of the communities, because we are not going to solve this problem with just the early childhood advocates alone. So another thing that was problematic about, I'm going to lead into another piece I want you to hear about, was what was not in Build Back Better was enough attention to states like Nebraska. The rural conservative states in this country, it was the bill was actually costed out on the fact that probably about 17 states wouldn't take it. Now, is that the way we want to do business in the United States? That we want some states to get more and some to get none? And so I am sitting here telling you that we need to think about this, and we need to come together as a country, all states, all people, that we cannot build a system for the haves and the have-nots, whether it's haves and have-nots in parents or haves and have-nots in states. So it's time to really think about our strategy. The other thing that it would have done was put on top of the current programs in the current system 2 more big programs. And are putting new programs on top of things the answer? Or do we need to really think about what we're doing with the basic system? Did we need another pre-K program when 47 states have a pre-K program already? And we have Head Start. So I'm just asking you to think about these things, because I think we were setting ourselves up in that bill for some really serious challenges across this country. So that leads me to what did we do where I was at the time and why it relates to Nebraska. In working with the U.S. Chamber Foundation, BPC at the time, we said, okay, we don't think, if this passes, when we thought it was going to pass at the time, we need to be doing something to build capacity in some of the states that we knew were probably not going to take the money. In the conservative red states where they had not taken Medicaid expansion already, okay? And those are in the CBO score, if you want to look at it. CBO knew which states would probably not take it. So in working with the U.S. Chamber Foundation, we thought, well, we need to build capacity in these states so that they understand why these things are important and why states need to take this if it passed, okay? So we started with 9 red states, very conservative red states in this country, to build that capacity. And we didn't have any big agenda. We just said, okay, we're going to call in the state chamber, a local chamber, the state government official managing this program, and an advocacy person who could represent the community. And let's talk. What can we do to help you build capacity? What's stopping capacity in your state? So in those 9 states, I will tell you that we've had some really big successes just by getting the business community to the table and going to the legislatures and saying, we need to fix these things. We need to fix this. For example, I can name 3 states right now that Alaska, for the first time, put money into childcare in the state. First time ever. Alabama, first time ever, put money into childcare. Why? Because the business community, Toyota, some of the big car companies said, we need to fix this. We need to do something. Alabama legislature put money in for the first time. In South Dakota, which I would have said, no way, 98 businesses came together and went to the legislature and said, we've got a child care problem in this state. Now, what are they doing? They have a task force going on right now that is, I think, reporting out almost any day with a plan to go back to the legislature and say, here's how we're going to fix this. And the legislature directed it. They went around the state. They listened to people. So these things worked. And the governor of Idaho put $25 million into facilities. He ran it through the economic development, whatever, sorry. You can wave your little thing. But he put it into the agency that he thought he could move it through. And no one in that state objected and said, no, we need to put it into childcare. It was, if they could get it in the Economic Development Office, then they were fine with that. And that's the way we need to start thinking, okay? So I could go on with other states where we didn't tell any state what to do. We set the table, we had them come together. Some, for the first time, the business community met the child care people. But what my message is here, the business community, once they understood the problem, were all in. And they have made things happen that I would have never predicted in this country. So we need now to start thinking about how we build that capacity. So where do we go from here? I'm going to say something that, please don't, I guess you might take offense at it, but stop whining. We need to stop whining, and we need to put facts on the table. We need to understand I said, as you know, I was with the military for years, and I've told this story along the way. I had to go to the budget table in the Pentagon, like people who flew airplanes, steamed ships, I didn't even know what that was at the time, and defend the child care budget. And I would have been laughed out of the room if I'd have gone in that room and said, oh, I need $50 million because kids are cute. They would not have put up with that. What I had to do was go into that room and say, if you give me $50 million, I will give you this many spaces in child care, this many in family child care, this many in preschool, and then hold the services to it. And they had to produce. How hard is that? We have got to start putting things on the table and holding ourselves, all of us, accountable for what we're doing. And there needs to be some noticeable change. Now, here in Nebraska, I would applaud you because you're seeing that. We've been tracking, when I was at BPC, we were tracking the gap analysis. We're doing the gap analysis. We've done Nebraska now 4 times. You have increased, thanks to your rural efforts in this state, the number of spaces in child care in this state. The negative side of it is your workforce participation is actually decreasing, that women are not coming back into the workforce at the same levels before. Why is that? Because they don't have child care. A lot of it is. So again, we've got a point to make here. So let's start pitching those things. So my first thing, stop whining. Let's give them the facts. Let's go for it. Stop telling people what they already know. I have been in 2 big conferences in the last 2 weeks, and I have heard people talk about the workforce. The workforce is poorly paid. Blah, blah, blah. People, that isn't cutting it. What do you want to have done about it? Now, we have a bill here that's talking about something to help the workforce. But we cannot keep saying, here's the problem, and not offering a solution to it. So if the problem, going back to one of the things that I learned when I worked with Congress with the military, first thing they would say to me in terms of our budget, how much do you need and what is it going to cost? 2 questions. Can we answer those questions for Nebraska right now? How much do you need? What's it going to cost to do it? So I think we need to be thinking about not telling what they already know, because there's no person on this planet that's been alive during the last 4 years who doesn't know that the child care workforce is poorly paid. Everybody knows that. So what's our solution to it? And how are we going to move the workforce from where they are now to higher levels of competency? So, next one. We constantly talk now about quality matters, and I heard it already here. And I agree, we all agree. Is there anybody that wants to say, no, we think it's okay to have poor child care? So what's your point? What is quality child care? That's a question I still get asked, by the way, and I have a hard time answering that. So we need to think about what is it that we really want to see in terms of quality. And back to the other thing we hear all the time is we need more money. For what? How much? We just need more money. Again, let's go back. A few years ago, I did some work with, anybody here know Frank Luntz? who he is. He's a Republican pollster, always on the toe. He does the dialing. And I took him to, actually, Colorado, and where we set it up for 30 families, parents to come in, conservative, moderate, Democrat. Okay, they ran the spectrum, and they were screened by Frank's crew. And what I learned in that is a couple of things. We really need to be clearer about what we're saying. So we went through the drill, the dial up, dial down, and I could go on and on about what we learned with that. But one of the critical things that I learned is Frank at the end of this, and anybody who knows him knows he can be a real character. I'm behind a window with a couple of people watching all this and watching the dialing go up and down, right? Frank turns around, looks at the room that I'm in, and he said, and now I'm going to ask the lady who asked me to do this to come out and tell you why she asked me. And I'm sitting here going, I did not expect to go out and do anything with this group. So I go out, and I sit, I'm standing there, and I said, well, we really want to understand what messages are going to work with, what communities, and I go on a little while, and I said, and we really know that it costs more to produce quality than the average person can afford to pay, right? We all get that. So, and the workforce on top of that is poorly paid, and half of them, are, really in have serious. So he stops. He says, stop. Okay, you dialed her up on certain parts of this, but when she talked about the workforce is poorly paid, you dialed her down. Why? And you know what the answer was? Simple. They said, well, we don't know what these people make. How do we know what they're poorly paid in relation to what? And it really made me stop and think about what is it that we are saying to people? What is poorly paid? How much do we need? Are you getting my message here? I mean, we really need to quantify these things for people and put some solutions out there. So it was embarrassing, to say the least, but it was a lesson that I needed to hear, because I was doing what I just said to you, blah, 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 to these people. They didn't know what I was saying, what it meant. So answer the 3 questions. How much, for what, and who pays? That's where we need to go. So one of the things that I wanted to talk a little bit about is the workforce, because I do think that we have got to address this, and we have to address it in a systematic way. It isn't just about the pay. It is about how the pay gets into their pockets that we have yet to figure out completely in this country. And I always, when people say we need to pay them more, well, we have a workforce that is essentially family child care. Some work in faith-based, some work in schools, some work in their own child care center, some are nonprofit, some are corporate, right? How is the money going to get into their pocketbooks in all of those different settings? That's a really hard question to answer, and we have got to figure that out. Because we can get the money to pay them more, but if we can't get it into their pocketbooks in a consistent manner that is dependable, we can give them a bonus, but when the bonus is gone, you don't buy a house on a bonus, okay, in this country. So we have got to figure out how we get money into these people's paychecks in a way that they can count on it and that they can use it for basic living. So the workforce is an issue, but it's about an issue bigger than just how to pay them. It's about how we finance the whole system. And we have not figured that out yet either, even though we did learn something from stabilization, and that we learned that we needed stable funding in these programs so that they could pay their people better. So it is about not just the workforce and not just the money, but how the money goes into the programs that creates reliable, durable change. And so I think that my other piece on that is to think about those things as you propose solutions to your legislative people here. Finally, we really have a stressed out population here. We have stress in multiple ways in early childhood. And I would be remiss, and my friend Walter would not forgive me if I didn't bring this up, because we have stress on our families are stressed out. You didn't see the New York Times article last weekend on the front page about the stress on American families, about children who are stressed, who have been bounced around in a lot of ways for the last several years in the system, and we wonder why they're stressed out when they come to our child care programs. And then on top of that, we have a stressed out workforce, and we have data on that. So we really do have to start to pay attention to what's going on with the stress levels in this country and the social emotional development of our families and our children and our workers. Not just one, all of them. And so I would say that as a part of any plan here in Nebraska, you need to be thinking about that. So now, where does that get me? So where do we go from here? And I would tell you that I think the first thing, actually let me back up and say, I do want to say some things about Nebraska, because I want to acknowledge the work that has gone on here. And I think that I've gone back and I've started to look at everything that's been done in Nebraska. And you have all of the pieces that you need to build a comprehensive plan and strategy to fix this. You have done a cost analysis. You've done the economic impact. You know what your gap is. You've looked at the rural issue, something many states are still struggling with. You need to, what I would say is, tie this in a bow, people. Where is your comprehensive plan to fix this thing? And it is not just one thing. It has got to be to fix the whole system rather than fix just the workforce, or let's fix the inspections, or let's fix family child care. We need a plan to fix it all. And I would say, I've often asked, why was the military successful? And I will tell you, we were successful because it was a complete overhaul of the military system when we did it. We had to take on the inspections, the standards, the workforce, all of it. What are parents paying? How much should they pay? And it was painful. But I'm telling you, you have all of the ingredients already in this state, but you haven't put them into a package that your legislature can act on. And it really does need to be a comprehensive package. So I would say tie that bow. If I were in your shoes, I would figure out, how do we get from here to that final package that people can understand? What will it cost? And then how are we going to how will we achieve it? Be accountable for it, and make sure that it's incremental, that we can get from here to someplace else. It's not going to happen overnight. In the military situation, it took us a good 5 years. But we did get there. And we had, when I left the Defense Department, 100% of our child care programs were nationally accredited. So it worked. And it wasn't easy. But you can do it in a state like Nebraska when you have commitment like I see in this room. Okay? So what will get us there? My final sort of, I guess, words of advice to this group. You need to build the biggest tent you can figure out, and this is a pretty big tent in this room with a lot of people and a lot of, where's the sheriff that I met earlier today? I love, wherever he is in the room. Anyway, you've got everything from a sheriff to a legislator to a senator. Everybody's in this room. So come on, people, let's figure out how to get all of you to the table and figure out what is the plan for Nebraska to move forward. You need to listen to people. And this is where it gets hard, because we as early childhood, we've seen, the light, and we have the answer, and you do it my way and we'll be fine. Nope, we need to listen to people, and we need to hear what they have to say and come to the table and talk about it and be willing to make some compromises. That's what bipartisanship is all about. That's what government needs, to be willing to make a compromise. And I want to say one last thing to you. I want everybody in this room who goes out of here and wants to talk about a problem that you are dealing with in your community. Every time you talk and bring up a problem, have the answer. Don't just dump a problem on somebody's table and then walk away. You need to think through what is your solution. And Senator, you said something like that earlier. In the meeting when we were talking earlier, we need solutions. We don't need more problems. We know the problems. So my advice to this group is to, I guess, pull up your pants, put on your big girl panties, and let's get this done, people. I think if we don't do this in the next few years, we stand to lose an opportunity for the next several decades. We are at one of those points in this country where everything is in our favor. We have it all, but we have to turn it into something that we can get through Congress, your legislature, your county, your communities. Because it is not just going to take one. It is not going to be coming from Washington, trust me on that. It won't actually come from the state. It comes from the communities that you all represent. Build it up, and then figure out what can we jointly do to make this work. So those are my messages to you. I think you've got an excellent base to build from, but now's the time to step it up. And let's get something going here in Nebraska that can solve the problems for your families. So now I'm going to invite our panelists. We're going to have a conversation with representatives. So if we want to come up, Shoshanah Inwood is a researcher with, Shoshanah, I will say, the Ohio State. I get that. Who is a rural sociologist and an associate professor of community, food, and economic development at The Ohio State University. I've known Shauna for several years now, and she's doing research on rural childcare, and she has some amazing things to offer to this audience. Our second panelist is Bryan Slone. He became president of the Nebraska Chamber of Commerce and Industry in May of 2018. You just joined in a really fun time, didn't you? Just before a pandemic. And I'm also, Bryan, want to have this conversation with you. He's a tax attorney, and I'm always like, okay, let's have a conversation, because we have a lot of things we can also fix with tax policy. In addition to having been an accounting professor at UNL College of Business, and he has taken on childcare as one of his concerns. And finally, Sarah Taylor Vanover, whom I've also known for a few years. She was actually in one of our chamber groups that we started after COVID. She's been working in early childhood for over 24 years. She's been a teacher, a director, a trainer, a college professor, and she was also the state child care administrator during the beginning of COVID in her home state of Kentucky. And she's now director of policy for the Kentucky Youth Advocates. So we're going to have a conversation here, and hopefully you will get more out of this panel than you did me. Okay, so I want to start, Shoshanah, with you. And we had a conversation about this. Tell us a little bit more about your research and exactly what you found, because in a rural state like Nebraska, I think that's extremely important.
Yeah, great. So first I'd like to see by a show of hands, how many of you are farmers or ranchers, or someone in your family is a farmer or rancher? All right, wow, it looks like almost half. Okay, now how many of you eat? Oh, great. So we're all connected to this issue. So Nebraska is definitely a farm state. Go Huskers, right? I say that for the Ohio State with full pride, with full respect, I should say. And so the farm economy is really important to the entire state. And I was looking at some of the data around Nebraska. So there's over 44,000 farms in Nebraska. But this number has actually declined by 5% since 2017, the last time the Census of Agriculture was taken. And since 1997, you've lost over 10,000 farms. That's 10,000 businesses that you've lost in your rural communities that are so important to the everyday functions of grocery stores, schools, your tax base, all of the parts of economic development and quality of life within a community. And these are not unique issues. Across the country, we're facing this loss of farms and farmland. And in Nebraska, the average age of farmers is 56.1. You're actually doing a little bit better than the national average, which is 59.1. And when USDA has been recognizing that, and a lot of states have been investing in trying to grow the next generation of farmers and ranchers, and trying to invest in access to capital and credit and land access, which is all really important. But really, we've been overlooking some of the social and household level issues that are affecting farm families. And in Nebraska, over 93% of farmers are farm families. Right? So that means that there's caregiving that's happening within these farm families. And so Nebraska is very similar to most of the country in that way. And one of the things that's really interesting is when we started doing this research over 15 years ago, when you survey farmers with children under 18, 2/3 of them nationally have challenges accessing affordable, quality childcare. Okay, that's across the country. And this has serious economic impacts. I just want to share a little bit of the data with you very quickly. So over one in two farmers, 48%, say access to childcare is important to the economic viability of their farm business. And the way that this has very specific economic impacts is that 3/4, over 77%, report that taking care of children affects their ability to get the farm work done. Right? Really important to that economic profitability. And 1/4 report that childcare costs limit their investments in the farm business itself. It's nationally, one of the things that we've heard by talking to farmers around the country, by doing surveys nationally, and again, this includes Nebraska farmers, is there's a kind of this idea out there that farmers don't want help with childcare, right? But the truth is really that they can't afford childcare. And I should also say that farmers and also acknowledge what wonderful places farms are to raise children and for children to grow up on. These are wonderful, wonderful places. But then there's a whole other reality there, again, of having to get the work done in a safe way. And again, there's this myth that farmers also have farm families that are there that can support them in their work and take care of the kids while they're working. In our research, which again includes Nebraska families, 65% said that while they do have family and friends close by who can help with childcare, 42% report that those friends and family are too busy to help out. And 1/4 report that those friends and families have health conditions, which make it very difficult for them to help out, right? So this is a really serious issue, especially when we think about farm safety, right? I'm sure a lot of you are aware of how many issues there are connected to farm safety on family farms. Nationally, every 3 days, a child dies on the farm. And farm safety experts have done a lot to recommend that the safest place for children is off of the farm work site. But where can people put their children, right? What kind of childcare is actually available? And what we found in our research is that 86% of farm families are bringing children to the work site because they have no other alternative. So I guess in sum, one of the big things that we've been finding from this work of over 15 years is that childcare is an issue for the farm families. They do want to talk about it, and we're really excited to be part of this conversation today.
Well, thank you. I do think it's extremely important, and I didn't note in the introductions of Shoshanah, she was also a witness before the Ag Committee and the Senate this last year, testifying on the Farm Bill. So hopefully we will have some major impacts in multiple legislative areas. Okay, Bryan, you're up next. And most of the childcare in this country are small businesses, and you represent small businesses. So childcare should have kind of a double-edged meaning for you. How do we support small businesses, and what can be done here in Nebraska to do more to support small businesses, and at the same time those businesses support other businesses? And how do we make sure they're here and they're there, available for businesses in this state?
Yeah, I think for small businesses, all kinds of small businesses, and that in some of our largest segments of small businesses are in the ag sector. Mm-hmm. But for small businesses around the state, we all deal with what I call the law of small numbers. And forgive me, I'm an accountant. The law of small numbers goes like this. If you have a small business with 5 employees and 2 leave because of lack of available or affordable childcare, that's 40% of your workforce. Your small business is toast. You're not an employer that hires 2,000, where 2 people missing on a given day is something you can manage. That's true both in any kind of small business, but also in this industry. Is that the same issues are within this industry that's everywhere else. So one thing, I'm going to point to 2 different things. One thing is, as we develop solutions, I'm not saying they're easy, because no solution in this area is easy. But for instance, in Nebraska, our hospitals are often an epicenter of how we develop solutions, because a lot of them need 24/7 childcare. So if you're in a community, it makes sense to work with your hospital. And you all have large employers, and they're all actively working, and many of them are just developing their own private solutions as well. We have many large employers in the state with childcare on site. But as we build capacity to serve larger companies, if all that does is pull the workforce from those serving large companies and away from small businesses, we really haven't solved the problem at all, when the majority of our businesses are small businesses. So from a capacity standpoint, we need to be able to be nimble in terms of developing. To the senator's point, there is no one-size-fits-all solution. It has to be a solution that meets small business. It has to be a solution that meets large business. One other point I'm going to make, and you're going to hear it from me all day today, is the workforce issue is by and large a demographic issue. The workforce issue we have today is the tip of the iceberg. And it's not just for us, it's for the majority of the states around the country. Mm-hmm. And you've heard me probably say this before. Our largest class in K through 12 this year is our senior class. Every class behind the senior class gets smaller. Our kindergarten class is our smallest class of all in Nebraska. So if nothing happens in this country or this state to start increasing either births, and that, as my good friend Senator Flood would say, is an 18-year solution, this workforce issue is going to continue to get worse. And so we can steal people in this industry, but we might be taking them from nursing, which is actually our hardest hit industry within the state. Tomorrow is Immigration Day for me. There is no solution without bringing lots of people into this state. And so these things start all tying together. And we're going to have to put more people in this state. Otherwise, we're just stealing from one industry to another. And in the long run, none of that's ever going to be sustainable. So I'll talk about that a little bit later. But the 2 things we have to be very careful of is whatever we do in solutions, we have to be nimble enough that it deals with both large business and small business. And 2, that we're also working with those who are trying to bring the amount of people that in this state that it's going to take to fill these jobs. And right now that number is about 50 to 60,000 people into this state.
Bryan, just as a matter of note for the audience, I think one of the things that always surprises me about the business world is the percentage that are small businesses. Back to the point here. Am I right? It's like well over 95% of all businesses?
The bulk of the businesses formed in Nebraska today are LLCs with 10 or under employees.
Okay, Sarah, you come to us from Kentucky, and Sarah, I think, has done some very amazing and innovative things in her work. Nebraska, clearly, I think I tried to make that point, has done a lot of good things and done their homework. The rural effort in this state is amazing. But what other things do you think should be considered here in Nebraska? So what have you learned from the work that you did in Kentucky and continue to do in Kentucky that you could advise these people on?
Well, I would say that our states have a lot of similarities. We have a very rural population in Kentucky. It's not all farming. There is farming. We have a big equine industry. We also still have coal country. We have 2 major urban areas surrounding Lexington and Louisville. where you go see the Kentucky Derby. But we have lots of small counties. We have 120 counties in Kentucky, and 79 of those counties are child care deserts. Access is a huge issue for us. And a lot of it has to do with the size of the counties and the number of the people and transportation. Centers do really well in urban areas, but they don't do as well in rural areas because you can't get 20 families to all travel to one center when it's too far away. And so one of the things that we have desperately tried to do in Kentucky in the past 5 years is grow our family child care network of family child care homes throughout the state, and we really lack in that area. So right before the pandemic started, we implemented a paid family child care network in Kentucky that would not only go out and recruit new family child care providers, but would be there to help them do their taxes, would be there to help them get training on family child care instead of just going to a training that was meant for a center of 100 people. And so that was a first step for us because we need those family child care providers in the rural area more than anything. We need people that will offer care on nights and weekends, and centers don't typically do that. Not everybody works a 9-to-5 job and can have care from 7 a.m. to 6 p.m. And we saw that throughout the pandemic with hospitals. Like you said, hospitals were calling me saying, why have we never thought about employee-based child care? And I'm like, I don't know, why haven't you? We need that for manufacturers. We need that for a lot of different hospitality and retail. And so we're working there. Our family child care network has regional hubs throughout the state. When people leave the child care field, when a program has closed down, because we know that we've seen those closures with the absence of sustainability payments, things like that, our family child care provider hubs are reaching out to those centers and saying, do you have staff that might be interested in being entrepreneurs? Let us give them a startup grant. We'll help them pay their zoning fees. We'll help them make their first insurance payment. We'll help them make sure their home is safe, and then they can be a small business owner and start their own program. And so we're working really hard on that, and also making sure that there are friendly zoning laws in communities. And this is a community level effort. I know in Kentucky we tried to look at it at the state level, and communities want to make their own zoning laws. They want to figure out how that works within small communities. So we're doing grassroots level advocacy in those communities and saying, this is not a storefront business we're bringing into your neighborhood. This is a home, and we want it to be in home areas. And we want to make sure that people feel like it's a home, but we want to help these businesses, and we want to make sure that your community, your neighborhood, has the child care that they need so they can go to work when they need to. My pet project that I have loved more than anything, because I was a child care provider and a director for years, is that in 2022 we launched our free child care for child care providers. And so if you work 20 hours a week in a child care program, which is the requirement for anybody who has a job and gets subsidy, work 20 hours a week, then your child care will be covered by subsidy, even if your income is over the limit or you have a partner whose income is over the limit. Because we lost, oh, I like the heart, there you go. We lost so many people during COVID because all of a sudden Target was paying $16 an hour. And you could work in the kitchen at Applebee's or different restaurants for $17 an hour. And the average child care wage in Kentucky post-pandemic, after wages have increased, is $12.39 an hour. So I know the exact cost of the wages in my state. And a lot of those do not get health insurance and benefits. And so you're thinking, I grew up wanting to work with kids. Nobody grows up saying, I grew up thinking, I want to stock shelves when I grow up. They said, I want to work with children. But then they got there and they couldn't afford to feed their family. So they left and they went to Target to work there for $16 an hour with health insurance. But if you're working at Target and you have to pay for 2 kids in childcare, how much are you bringing home? And we were able to say, okay, we're going to offer this to you, and we can bring you back from Target. You can be in the same building with your children if you choose to. You can also choose another place. But a lot of us who worked in childcare worked there because our kids were young. And when I worked in policy, but when my babies were born, I went back to being a director because they were down the hall, and I wanted to see them. And so we can bring those people back for a season at least. I always thought that we want them for a lifetime. We want to keep these people here. Why are they leaving? Man, if you had them for 5 years, based on the turnover rate in our field, 5 years is a commitment to have people in the field. So if you have them when their children are young, or you have them while their children are in school age, and you can have them there enjoying their family time, getting to go on the trip to the pumpkin patch with their kids to be a staff member there, and then they don't have to pay that burden. Right now we have 6,000 providers in Kentucky. Well, we have 6,000 children enrolled in this program, 3,500 child care providers, so a lot of them have 2 kids. Man, 10 years ago, when I had an infant and a toddler, I paid $18,000 a year in child care. Now it's humongously increased. Think if you didn't have to pay that, and you could work at a job with young children that you loved, but you didn't have to worry about the burden of your own child care. I had a lot of questions about, well, this doesn't apply to everybody. Not all benefits apply to everybody. Right. Paid family leave doesn't apply to everybody, but man, we know that if I'm not somebody using it, and I know that my coworker is going to come back from their break, it takes a huge burden off me. If I know that my coworker is going to show up every day, because you're much more likely to stay at your child care program, as an employee, stay at the child care program because your kids are happy, then that turnover decreases, and I'm happier as an employee too. Kentucky right now is about 92% center-based. So this really fits a niche for us. There are more family child care providers that we have to figure out how to include them. They can still utilize it, but it doesn't apply quite as much to them when you can't be paid to watch your own child. But through programs like this, through programs like, we kind of took a spin-off of Michigan's TRICARE called the Employee Child Care Assistance Partnership, where a business can say, a small business that does not want to put on-site care when you only have 10 employees. But they can say, I will contribute $100 to your child care. The state matches it, and then the parents pay the balance. When I had young kids, if somebody offered to take $200 off, even if they weren't paying for all of it, I would be like, yes, take $200 off. That's a week and a half of groceries. Or they, the employer could say, I'll pay half of it, and the state could match up to that too. That would be awesome, but we don't all have that flexibility. We have put this into process around 2022 also, and at least 25% of the funds are reserved just for small businesses so that big businesses don't come in and take it over. And so with some of these programs going on, we've seen innovation that we haven't seen before. And Kentucky was never a state that gave more than their minimum federal match to get CCDBG funds. We never put state general dollars in. But we finally were able to talk to our legislature about this is affecting the community economic status, and we need you to listen, and we need to try something different, because just saying throw money at it hasn't been working.
Sarah, could you talk a little bit about the partnership with the Chamber in Kentucky, because I know it's rock solid. It's very amazing, and the extent to which the Chamber helped, in some of these initiatives.
My background is all early education. I really had never worked with business people before, never worked with economic development. And when Linda talked about the group that she started in the 9 red states, Kentucky was one of those. And we partnered with our Chamber of Commerce. I knew our chamber person because I had worked with his wife previously, but I had never actually had a conversation with him until we started with the Bipartisan Policy Center and the U.S. Chamber Foundation. Now I would say he and I go to most of our legislative lobbying meetings together. We sit down and say, who are we going to talk to? This is what we're going to do. Kentucky is a state that has worked hard to reduce its income tax. That has been like the legislature's primary goal. So we want fewer taxes. We don't want to spend as much. We want to reduce the income tax level. But the chamber is saying this is the one area that we want you to spend more on and not less. And then I come in with a boatload of facts and research and data and show them how it works in communities. And the chamber's like, listen to her, we'll partner together. We go to all these, because I wasn't a lobbyist really. My master's in early childhood special ed, I didn't learn about this. So the chamber has helped me a lot in knowing how to navigate politics. And then I've helped them a lot on the content for the area. And now we've formed coalitions in the state. For the first time ever this last legislative session, Kentucky put $80 million of general funds per year for the next 2 years into the biennium budget. And It's continuing for 2 years to fund more of the free childcare for childcare providers, and we've maxed out our reimbursement that the feds will let us on the child care assistance program for subsidy.
impressive.
And they let us let us maintain that level. Now, we have a lot of work to do still. It's not where I want it to be, but man, for a first step, for the first time they ever gave us money, and it had a lot to do with the child care advocates and the chamber coming together.
Thank you. Let's keep going here because I do want to, talk a little bit more, Bryan, about the role of businesses in this conversation, because I think often people approach businesses and think you either need to provide it or pay for it, one or the other. And I'm always struck by the fact, and personal opinion here, is that I say to businesses, I don't want you to pay for it, I want you to support it. And your thoughts on how we do that balance, because some businesses can provide it or can pay for it, like TriShare. But there are, to your point of the small businesses with 5 employees, they don't have that capital.
They don't have that capital, but to the point of, in Kentucky's a great example. If there were a standardized employee benefit, and it was just like health insurance or something like that, and maybe it didn't pay the full cost, maybe it only paid $200, but that, if it was a simplified process, small businesses could provide employee benefit in many, many, many cases, because trust me, it's the #1 issue for every employer in the state, which is workforce. And it's, every survey we take, it's 80%. This is what they spend their days doing. And so I do think we can ask businesses to put skin in the game, and they will. Business people are problem solvers, just like you are. Every business person is a problem solver. Every farmer who goes out every day doesn't know what the problem is going to be that day, but there will be one. It's guaranteed. And so they're problem solvers, and I loved what you were saying earlier is doing what Kentucky's done and coming to solutions and getting people around the table and building solutions that are actually sustainable. That's music to the ears of the business community. When it's, more taxes and more spending, that's never music to anybody's ears. But if it's, let's find a solution to a specific problem that is your daily issue, that's music to the ears of business.
I think it gets back to, I keep going to the senator and calling attention to his remarks, but I think what the senator was saying about it being an investment, I think both of you are saying that in multiple ways. It is an investment in our kids and our future, and we can't ignore it. Okay, Shoshanah, I want to kind of turn to you, and you've brought a number of groups to the table in this policy conversation, new groups that have not endorsed child care, for example, in the Farm Bill. How did you do that, and what can we learn from that?
Well, so Linda, I think it's to your point earlier that you were talking about is how do we build coalitions, right? And what are the points that we all agree on, right? And one of the things that we've done by just going out as a researcher and asking questions is you find out very quickly that farmers, no matter what you grow or how you grow it, have a family that they love and who they care about and who they want to be healthy, right? And so by finding those commonalities, that's really how we start the engagement process. And I think, the point that also I was really struck by as you've been talking about is also recognizing how diverse the farm community is, right? And so I think sometimes we think, farm community, there's going to be one organization that represents them. But as you will find out is that there's a lot of, and putting on my rural sociology hat, there's a lot of disagreement within farm communities. There's a lot of different viewpoints within farm communities. And so understanding different organizations that represent different farmers is really important so that you can invite all of those groups to come to the table so that you have a broader coalition that you're building. Also, just in terms of Chamber of Commerce, I think what's really interesting is most farmers do not belong to the Chambers of Commerce. So when you are engaging with Chambers of Commerce, you are also missing out in a population, especially in rural communities and in farming communities. So making sure you're working with folks like in Extension and all those different farm organizations, and not just at the state level, but really at the local level, is super, super important. I'm going to add one more thing, if I can. is that this conversation is very exciting around early childhood education. But again, when we're thinking about workforce attraction and retention, and we really need to think about what happens when kids graduate into those school years. And the thing that we've heard from farmers is how important schools are to being able to get the work done, right? Because that is a safe, affordable place, especially public schools, right? And so thinking also about what is the quality of those schools is as equally important for workforce attraction and retention as those early childhood years are. And the other part with farmers is also thinking about what is happening in the summertime, right? Are there available camps? What does childcare look like for a variety of different ages? Because farmers will share, their families are just like all of ours, where some kids might be really interested in farming and some kids are not. And some kids might have social, emotional, physical health issues that don't allow them to participate in farming. So it's much part of a bigger coalition, as you were saying, with healthcare and other forms of economic development.
Tell me about the two that that are now included. I think the Farm Bill this time was endorsed by groups that had not done it before.
Yeah.
And?
So it was really interesting was that Farm Bureau and Farmers Union, those two groups are the nation's largest farm organizations, and they tend to be, have very different viewpoints on policy issues. And what happened this year, I think especially because of COVID, was that they found that this is the one issue that they could agree on and go hand in hand like they had done with opioids. And I will just share very quickly with you, like even as a researcher, have been shocked at how much response there's been to this project. Again, like I've been doing this for 15 years, but what happened during COVID when we had one particular project where we were looking to do focus groups with farm women raising children on farms in the 3 states of Wisconsin, Ohio, and Vermont, we gave ourselves 5 weeks to recruit 36 women. In 5 days, we had 108 women sign up for focus groups. People came wanting to talk about how hard this issue is and how much they want something done. And just one last stat, and then I will stop talking, is that what we found nationally, and again, this includes Nebraska farmers, is that over 76% want farm organizations representing their needs in national child care conversations, and over 71% want USDA representing their interest in national child care conversations. So there is a huge interest in this among the farm community.
Okay, I want to just work a little bit more on the sort of these unsuspecting, collaborators on this. I mean, how do we start to reach out to people that we don't? I think, Bryan, we talked earlier about housing. Housing is a huge issue in this country. Wherever I go in a state, I hear childcare and housing, childcare and housing. Those two things are what people are struggling with. How do we connect childcare to housing?
Yeah, so I think the two are hand in hand. I was having a conversation with the mayor out here just previously is where do you put first, housing or childcare? Do people move because of housing? Do people move because of childcare? The answer is yes. In every poll we take, both. And this town has a particularly difficult housing issue. It's very expensive here, and there's lots of fixes going on. There's lots of good things going on. I think what we have to realize in Nebraska, the reality of Nebraska where we sit right now, is attracting people is our number one issue. Housing and childcare are always at the forefront of that. We've got a short-term issue, which is we're going to have to make some significant investments in housing and childcare. And I'm not looking for the 40-year sustainable model. Is how can we put the right kind of investments in over the next 2 to 5 years that get us to the point of a sustainable model? A sustainable model is when the economy is producing enough tax revenues and the private sector is producing enough and the wages of the middle class rise enough that employees can actually pay for child care again. Because what's not happening is we can raise the wages in this industry, but if the general wage rate of the middle class isn't increasing, all we're doing is creating a situation where they can't pay for childcare, which is kind of where we are right now. And the way to do that is through productivity, which means we also have to invest in making Nebraska a technology state, because we have high work rates, low productivity, because we haven't integrated technology into all of our industries. And it's hard to say, but we have to do these 3 or 4 things for the next 3 or 5 years, and we've got to be laser focused in making the investments the senator's talking about: housing, childcare, and technology. And and then build the sustainable model through an economy that can support a sustainable model in the long term. And those are going to be investments, and that's the way we're going to pitch it. That means you need that whole group around the table
Yeah.
having that discussion, not different interest groups. It has to be a coalition, and I love where this is going.
One of the things I've been saying for a long time in terms of the housing issue, it's a natural when you're building housing to think about childcare, whether it's family childcare and how do you make sure that housing works for that, or just building it into some of these developments. Or, what we did a look at mapping in North Carolina, and we saw this great big place where there was absolutely no child care, worked with the state on that. We said, what's going on here? Because there's nothing, and there are a lot of families, a lot of children. And they looked at it, and they instantly knew what happened there. Big plant had gone in, housing had come up, and no one had thought about child care. So we have almost a whole new community where we had the others, but no child care. Can we not figure out how to think about these things in pairs?
And I'll lead into this, which I think what Kentucky is doing smart is, she mentioned transportation and zoning. We can't make ad hoc decisions about housing and childcare. We have to do better city planning to say, it does not make any sense to build housing and childcare where there is no transportation for the population that we're trying to serve. And so city planning now becomes, and so the action is actually at a community level with our mayors and city councils and county commissioners. We can do all these things at the federal level, and we can do all these things at the state legislature, but the true action and execution is at the local level.
I want to put a pitch in for one thing that I know we've talked about here in Nebraska. I've spent a lot of time at the federal level working on the facilities issue. And the business model of childcare is really a problem when it comes to having the capital to invest in infrastructure. It's just not there. We barely make the payroll in early childhood. So how are we investing in our infrastructure and our facilities? And I think we need to deal with that issue, as a part of this conversation. But the solution is not going to be just childcare, build more, and without understanding where the funding is coming from. The other thing I think is we're staying in a rural state, if I can jump in on this one for a hot second, is that I ran a child care center in eastern Montana. First one was 25 children, second one was 40. I know that how hard it is to make the bottom line in these things. The first one, the tribe sponsored. The second one, the Catholic Church sponsored. So I had facilities help. I had, the utilities and all that kind of thing. I keep hearing from people, well, we can't build a child care center in rural America because there's no economies of scale. Guess what? Yes, you can, but it is more expensive to do, not less. And I think we keep looking to make these things cheap, and we're sacrificing our families in doing that. And so I do, hey, 40 kids in a community of 500, it worked. But it was also a recognition that we need to start underwriting some of these infrastructure issues and facilities. Okay. Anyway, enough said on that. Sorry, I got off on a tangent. I want to just talk a little bit more about the quality issue, because we do have quality challenges, in part because of the workforce. Some bad facilities, some nothing. How do we begin to tackle this quality problem, and define it, and think about what is quality to each of these constituencies? Sarah, do you want to start on that one? I know that's kind of a complicated question, but I do think we have to deal with quality.
It is complicated. I think for a long time we thought, as a past director, you would sit down and have your interviews, and you were waiting for somebody to walk in who is completely qualified. And when you have an entry-level wage, having a completely trained person come into the facility is going to be a challenge. And I'm seeing a shift now of where we are hiring entry-level employees and then investing in that training. The number of apprenticeship programs has increased across the U.S. Kentucky has multiple apprenticeships that you can do either as a student, as an adult, a director apprenticeship. And so we're getting people young as they come in and then helping to grow them. And then along with that, they're getting college level training, they're getting CDAs, things of that nature. The other thing is that we're competing against Burger King, who offers a scholarship for their high school and college kids when they come in and says, we'll pay towards your college education. So in Kentucky, one of the things that we do have, we've had a scholarship program in childcare since 1998, but it only covered so much. You're a childcare provider and you can't cover your required gym fees and your books and things like that, then it's going to deter you from enrolling. So we've increased that program so that you can do a non-college CDA, a college CDA, an associate's, a bachelor's, and the program will cover the entire enrollment expense. So, but you have to work in a childcare at least 20 hours a week while you're getting it. Otherwise, you're disqualified from the program. Looking at ways to train those people up, and with partnerships and like the free childcare for childcare providers, the scholarships, growing these people through the programs, we've had our enrollment increase as far as workforce. I launched a survey just 2 weeks ago, and I'm looking at the results of directors. We've had 414 directors throughout the state respond so far, and 65% of them said they're fully staffed. Lordy, that was not the case 2 years ago. I mean, it was significant. We had all of these programs calling us and telling us that they had 2 empty classrooms because they didn't have staff, and they had unqualified staff. So those are issues. We also really need to think about our kids with disabilities. They are out there and they are enrolled in childcare, and if we don't have training for our staff members, then those are the kids that are getting expelled. Those are the kids that, if you've got a wait list because you're a childcare desert, your teachers are stressed, which we've already heard, the New York Times says that anybody who's a parent is stressed, teachers are stressed, then those kids are going to get kicked out to save staff. So we need to train our new employees on how to work with kids with disabilities and give them those strategies so that those families have the child care, but the staff are not pushed over the edge and decide to leave to go to Burger King.
Okay, I've been given the high sign here, so I'm going to move on here. What I want each of the panelists to respond to, I had a closing piece of advice in terms of you have to offer a solution every time you offer a problem. What is talking to this audience, what is the one thing you would say to them that will help us move this issue forward? What can they do individually? Shoshanah, let's start with you.
So I think one thing to also remember is that farmers work non-traditional hours, and especially depends upon what markets that they're taking part in, so that may be weekends and evenings. And also, most farmers are either not working full-time, they have another occupation off the farm, or somebody's working off the farm for additional income and benefits. And we know in rural areas that often happens in health, education, and government, and then there's also manufacturing. So I think really, and those also often have non-traditional hours. So I think thinking about how can we make coalitions in terms of engaging all of those different sectors and also having a greater appreciation for how the benefits that you may be making for the hospital system or your local manufacturer is also going to reverberate through the farm economy.
Bryan.
Yeah, I would in preparation have said we need to build these coalitions and stuff, but we've already talked about that. I think the one thing we haven't talked about today is parents. My job as a chamber president is to serve businesses. In the end, and I'm living this, I have a new grandson who's by far the smartest, cutest, best athlete that ever lived. But I'm kind of living the daily, daycare, childcare situation now with that. In fact, next week I'll be on my way to Atlanta for 4 days. See if I can remember how to change a diaper. And I think in the end, the constituency that we haven't talked about is parents. And frankly, we do a lousy job, not this industry, but we as a society do a lousy job of making it easier for parents who are stressed. Mm-hmm. It's different raising children today than it was when my era with Dr. Spock, and that seemed to be enough. They don't have the tools. And so as we think about these solutions, it not only has to be a community-based solution, not a federal solution, not a
Right.
state solution, a community-based solution, but also parent solution. And another day, another seminar, but we need to talk about what real parent solutions are.
For me, you know, listening to Linda speak solo before we came up here, one of the things that she mentioned was that some of us are whiners and we need to stop whining. and I'm not going to disagree with that. For so long, we've been like, we need more money, we need this, and we're just, you know, how could you not give it to us? But I think instead of doing the same old thing that we've always been doing, we have to think of out-of-the-box solutions. That's one way that we're going to get legislative members and policymakers to listen, is because we've said, okay, the old ways aren't working. We have to think of something different. If we can think of something different and we can get people's attention, then maybe we can implement it. And the other thing that I would just tack onto that is that child care providers have never been our own best advocates. We are in it for the love of the kids, and we know that we're going to make low pay, and we just do it. But now is the time for child care providers to step up and advocate for themselves, because you are constituents. You are voting members in your community. And if you learn about advocacy and go out there and really use your voice, then I think that's going to make a big impact.
Okay. Well, I want to thank the panel. What a great conversation, you guys. And I think some real experts here. So I would suggest to the audience that you go to the sessions and listen more to these people.
Thank you, Linda, and members of the panel, Dr. Inwood, Mr. Slone, and Dr. Vanover. We are grateful for your engagement here today. Your commitment to bringing more voices to the early childhood conversations is inspiring. Before our breakout session begins at 10 a.m., I have a few notes and reminders to share. If you haven't checked in and picked up your name tag, please be sure you do that right away. Your safety and well-being are our top priority. Though we have largely moved from a pandemic, please be respectful of each other. You'll find hand sanitizer throughout the venue, and there are masks available at check-in for anyone who would feel more comfortable with a mask. Restrooms are located near the lobby and at the end of the hall near the Silver Ballroom 6 and 12. Be sure to share your enthusiasm throughout the day using hashtag ThrivingChildren's2024 in your social media post, and share photos of aha moments you've experienced at the conference. If you have questions or need assistance throughout the day, be sure to stop by at the check-in desk. The conference team is ready to assist you. Now, you can pull out your phones, open your online agenda, and be prepared to enjoy a fantastic breakout session. We will be back here at 11:15 a.m. for lunch and program featuring inspirational local community success stories. Thank you. Gracias.